understand who is that person in front of us, how did they become to behave, feel, and think the way they do, what's the problem, where is it stemming from. I am Dr. Sofia Palsdotter. I'm the chief psychologist here at Mental Health Center of America. And I come from a background of varied kind of experiences in mental health, but most recently sort of working on the intersection of medicine and psychology, where I work with cancer patients in a big cancer center in Phoenix. And so I think what that brings to the table here is just this focus on the body and the mind, you know, the physical and the psychological, and the importance of really focusing on both. One of the things that makes us stand out is that we focus on a very in-depth, comprehensive mental health assessment. So often people feel that there's something going on, maybe they're in crisis, maybe they feel they're distressed, their function has, impaired in some way, and so they seek services. Unfortunately, mental health focusing on sort of this industrialized approach of sticking Band-Aids on those symptoms. We here at MHCA focus on diving deeper, to really taking the time. And I think often the Band-Aid approach comes from not enough time.
We're not directing our attention just to medications to manage their mental health disorder. We're utilizing all aspects of what that treatment plan should look like. Hi, I'm Dr. Mona Amini. I'm the Chief Psychiatrist of Mental Health Center of America. I am a local from the Valley. I did residency at what is called the Banner University Medical Center of Phoenix. And ultimately, I just want to increase the awareness of mental health and access to care for mental health in the Valley.
The treatment plan is really individualized. It's tailored to that person specifically. We do have a 12-week long program that everybody starts with, and that's not just picking 12 weeks from thin air. We arrived at that 12-week program because we think it takes time to work through issues, for the person to come to know themselves a little bit deeper, because it's really through that discovery that change can happen. The treatment can be varied. It can consist of psychotherapy, individual counseling or psychotherapy, often medication evaluation and management if appropriate. That's one of the things that we do here, I think, differently than many other places. We're psychologically driven, not medication driven, but we use medications appropriately to support and augment the treatment.
With Mental Health Center of America, the model is kind of to be a one-stop shop. So you're calling one number, and that is for an intake with a psychologist to get in touch, and established with a therapist or a counselor. Thereafter, if you're appropriate for a treatment that includes medication, then you're going to be referred in-house to a medication provider as well. Then we have, all of the other encompassing types of treatment. So we have meditative therapies, cryotherapies, other alternative forms of treatment for most of the mental health disorders.
We have all of the providers, the professionals under the same roof as well, which is really beneficial because a lot of the time these professionals aren't talking together. There's one treating this problem and another provider treating this, and they have no communication, or at the best, very little. And here we are communicating all the time, and that really benefits the patient.
There's a lot less of the doctor's office feel or like a hospital-like feel, and more of a relaxed experience.
We want to create this sort of this holding environment, where people come and they're usually in a vulnerable state. They may be in a full-blown mental health crisis when they come here, and they haven't had a place to go that creates that safety, that comfort. It's pleasant. We have muted colors on the walls. We don't have a lot of stimuli in terms of music and artwork. So it's really just pleasant, and people can come here and feel like they're held.
I am really excited because this really should be the model for mental health treatment. It really should be an all-encompassing model under one roof. I'm really excited about what the patient's outcomes will be and how they feel about this type of treatment, and to have this type of one-stop shop, if you will, all in one roof.
I want people to know that we're not necessarily focused on providing a cure for their ailments or whatever brought them in here in the first place. We know that that's not a realistic goal. It's a journey, you know, that people are on. And then I want them to know that this is really their mental health home. Having somebody come and help you look within can really help you put the pieces together and understand and then intervene earlier.